Welcome to Autonomy CEO Corner. I'm your host, Dennis Dicker. Today we'll be discussing the growth opportunity in the home healthcare industry, the PACE service where I'll actually share a live meetup in Philly. Then we'll continue on with the CEO Corner with Kyle China, who holds a BCBA and also the CEO of Prosocial Services. He'll be discussing ways to improve independence with the example ISP of Stacy. We will end the episode with a demo of the Autonomy application and how to access the free training opportunities. Let's get started. I'm going to grab my coffee and have a seat over here. As more and more people learn Business 101, if you have a for-profit business, the goal is to be profitable, or it is a nonprofit. Did you know you can have a for-profit business that runs like a nonprofit? With the right tools, you can generate enough revenue to create a social impact in your local community. With Autonomy, you not only get assistance starting your business, but growing your business with multiple revenue streams. Take a look at this sample timeline. The long-term care industry is set to double in the next 5 years, and the pandemic actually sped up the need. These are some big numbers, so bear with me. Take a look. One of the many questions we get is, what is the difference between home care and home health care? Within the home care industry, you have many service types, where within those service types, like hospice and private duty services, you or your staff can provide a specific billable service like companionship or medication reminders. We are confident with this timeline because just look over time. More and more institutions are shutting down or closing because people are looking to age in place and live in their home or community close to family and friends. Take a look. As you achieve Dean status, you're able to provide a direct professional service as well as aid services so you can have passive income as well. And as you achieve Dean status, you're at the forefront of really offering services to more and more payers. Medicare Advantage plans are growing rapidly through the years, and millions of older adults are signing up because it saves them time and money finding a provider in their local area. Well, don't take my word for it. Check out what CMS said. They announced new federal funding for 33 states to support transitioning individuals from nursing homes to the community. And I don't know if you've been living under a rock, but since the pandemic happened, everyone wants to leave a nursing home. And lastly, PACE is an alternative to nursing home care that through an interdisciplinary team of physicians, nurses, nurse practitioners, social workers, therapists, transportation coordinators, providers, and aides, more and more people can live in a community setting. Unfortunately, only 2% of the 2 million people who could be helped by PACE are currently enrolled. They're enrolling in other types of programs right now, such as Medicare Advantage plans. PACE offerings allow those to get a more personalized approach to care in their local community. Ready for the meetup? I am. Let's go.
No, you're right, because that's hard. So they do Medicaid, right? After they discharge, you do Medicaid. We keep out, I don't know, we refer them back to
You
BCBA.
keep them with layout.
Exactly, so it's
Because I
gonna
was
be
sleeping
a partnership.
and they won't raise it.
Escort
And they got me
credentialing,
this one like
billers,
this.
and
Yeah.
They got all this out there,
yeah.
home.
Oh, for PMRs.
So for PMR, that's obviously your PMR system.
Yeah.
You go
So
with
who are your
electronic.
guys?
It's like the Craigslist of PMRs. It's very like
Oh, I'm Medicaid.
2005 looking. It doesn't have like
Oh, so now
really
they, so now
nice.
Medicare, so somebody got Medicaid, well, Medicare
Looks,
pays for their Medicaid to pick up what they got.
What does
So they can
compare
go
to
more
the
hours.
rest? I mean, I know you look at the most important.
Yeah, but I don't determine.
Yeah. Yeah, so
Um,
Miko, what's up?
The other guys that are
Like I said, it's
incorporated,
right now, so whatever the coordinator puts in.
Billy's like
And then they have to do their
8%.
We in Philly, we got a meetup today.
And then they'll.
Some CEOs, so I decided to go live.
Every percent. Yeah.
Because for
No,
us, in
it's-
terms of our side, like adults with disabilities.
Well, right, so I literally just switched over.
We have a Facebook group that almost has about 1,000 potential CEOs in there. So we're also live in there.
So before.
So please join us. Today I'm about to go over PACE organization. It's for older adults that are 55 and older. So as you start your agency using autonomy, you'll be qualified for a PACE organization.
And then they're asking, now they asking for everybody's bank statements and
One called Railroad
they give
Care.
more problems to get it versus not.
Work for the railroad system.
Honestly,
At some
they should,
point,
because
they
there's a lot of
have
problems
different
going on,
branch
right?
of
Like,
Medicare.
Yeah, but they got people
I
who,
had no idea.
but now,
She figured it
well,
out.
not now, but if you own a house, if you're single, you own a house, they're not gonna take you, so they
Bill
want you to
our
sign
price
house.
quick,
I know,
it's like 5 things. And they're done.
I mean, it's like that with
Sequentially,
sometimes
I think.
assisted living.
Where you can do
That's-
it versus like your.
My referrals came from what, so I'm in a
So
little
same
bit
with
of a
home care.
interesting situation where I am bilingual.
So you better off just having somebody else.
And I live in the motion.
If somebody else is on it, then
Oh,
you
So a lot of the Russian.
Word of mouth.
Yeah. it's-
Cool,
it's-
join in.
I also.
I'll be going over a little bit more about the non-medical services and the medical services shortly.
Yeah, if you bother.
They're just talking on the side, so I'm just giving them another couple of minutes.
Because what happens
Exactly
if
where
they
you're
then
at.
need to go to a
I
nursing
see.
home?
Interesting.
Or,
Well, I don't know how to
It
say
wouldn't
it.
take
because they already sold their house.
No,
In
because
my mind,
it's
the
really
nursing
just
home,
it's out
you sell their house for the nursing home. But they already sold it to home
One
care.
on the team.
Mhm.
That's cool.
I mean, I guess the state just continues to kind of, but.
I'll have to do one.
Cool. So what did I leave out, or where should I start now? I could briefly go over the different types of, I guess, the growth plan that's in the business plan that I share with people. I think that could help everyone understand and bring more questions about the business plan. That business plan, I worked on it for many years while I was running my agency. I used a site called, is it Big Plan, something like that? But it's a site that people use or companies use to help them form their business plans. So when I was putting it together, it included the technology aspect as well as the service aspect to help people, to show whoever's reading the business plan that you're able to scale in a much more efficient way using technology. And so when I share the business plans with people, it's to give you an idea of the non-medical service side when you start to provide services to adults with disabilities and autism, and then the potential to expand into medical services. Most business plans do not include PACE organizations or the ability to really provide more services to older adults. It's focused on the Medicaid side. And so on the business plan, it talks about the program specialist, which is a regulation requirement to oversee the 24-hour care. And in the state of Pennsylvania, it's the consolidated waiver. That's the pretty big budget, is about $1 billion to help those that are in an institution or hospital transition into a community, because it's a third of the expense. So that's what I focused on, because that's where all the referrals were. And I wanted to really get the experience of really understand what's so hard about it if you're doing it right, because most of the people are doing it wrong. So imagine if you're actually doing it right. So as you start to get authorized for services, we establish that niche offering, which is adults with disabilities and autism, because 90% of them are unemployed. So like in the state of Pennsylvania, even though they have these supportive employment trainings, you got to find somebody that's going to hire them. If the business is not going to hire them, you could do all the training you want. When I started to join all these family groups and start to talk about how they're finding jobs for their family members. And the bottom line is these businesses, you can't depend on them. You got to initiate the business yourself if you're looking for something long-term, and you know long-term that your son or daughter or family member has a disability, So they started talking about, small businesses, a cookie shop or ice cream shop, coffee shop, maybe a burger joint. These are simple tasks that with assistance you could pretty much do. Burger joints are starting to be automated, unfortunately, and people are buying from them. So if you have one in your local community that's run by somebody with disabilities, I'm pretty sure people would, with the proper oversight or management, I'm pretty sure people would come to it. And that's when I start to share my experience with 10,000 small businesses, Goldman Sachs, 10,000 small businesses. I was a part of a group of nothing but small businesses where they were thriving, $1 million plus, where they have heavy experience in the small business world, in a network where we can ask questions on how to start a business or how to develop that brand if we were to start some type of small business for the consumer. And so with that type of approach, we're pretty confident in helping each one of you establish a small business if you want, or have the consumer, with the help of their family, establish a small business so that they can possibly pay for their long-term care. Something like that is not even close to being, not even close to being created these days. So that's really where a lot of families want, because they know that they can't pay for it, and they know that there's a small business that they can use those profits to pay for long-term care. So with your agency, you're able to oversee it. You're able to oversee it because you are using the technology that not only manages the care of the consumer, but can guide them to complete tasks. So if there are little tasks that they have to complete to maintain the job or to supervise another staff member, it could be all in the palm of their hand, if they could follow step by step. So something like this has been tested many years. It's not novel at all. So all you're doing is you're implementing it at scale or in your local community the right way.
Did you guys have any ideas for like your businesses that your adults with disabilities could be doing? I was just curious.
The options are endless. It could be any small business. It could be a car wash.
I thought it was really cool that someone on the group said, produce and like having, it was a rural area this person was talking about, but like having like a chicken coop and like selling the eggs and the produce maybe around the house. I was like, that's a really cool idea.
Right. I just wanted to put in the infrastructure in place. So whatever you decide with your creative minds, you'll be able to do that. If you're interested in starting that small business for your, most regulations don't allow you to actually own the business and provide the support of employment. So it'll have to be something separate from your agency. And so that's why in this type of setting like this home, the actual Airbnb is totally separate from Shayna's business. She doesn't own the Airbnb. She doesn't get profits from the Airbnb. But her consumers will be able to provide a service at that Airbnb where they can get paid some type of livable wage.
Like maintenance of the Airbnb.
Exactly.
Flipping it over.
Exactly, the check-in and check-out process. A simple task where
Learning hospitality skills and then the social interactions too. Like they want to live in an apartment by themselves and they need to learn how to interact with random people, you know, so it knocks out like working on social skills and supporting employment.
Right. So that's the non-medical service side. Everyone that gets up and running, use autonomy, we try to establish a hub and offer some type of unique opportunity for a job for the consumer, because all the consumers, 90% of them are unemployed. You want to be able to, since you're new on the block with your new agency, you want to give them some type of, you want to distinguish yourself. And the best way to do that is to give them something that other agencies can't provide. Affordable housing, a job. That's the best thing yet. On top of your clinical oversight. Me just saying it blows me away because it's just amazing. Like I can't believe like we're doing this. But yeah, it's amazing.
I mean, I say it all the time, but I feel like we're literally going to change healthcare. I really feel that way. Like, this is
Yeah, it's definitely cool. So once you're start to become authorized for services, the first two services that we try to get you approved for is the supportive employment and community inclusion services, because with those two services, you could very well get consumers that are receiving 20 to 40 hours a week, or maybe even 50 in Pennsylvania, of a mixture of community inclusion and supportive employment, like 20 hours a week supportive employment, 20 hours community inclusion. And that type of service offering, you'll net maybe between $2,000 and $4,000, where you'll be able to take some of that money and subsidize their housing, offer livable wages to your staff, things like that. So yeah, that's the first 9 months after you're up and running. We help you basically ramp up our services by marketing to the different support coordinator agencies. If you're in Pennsylvania, again, you have a major advantage because I know all of them, most of them, and especially on the autism side. But it's going to be a lot of fun as we reach out to the different states, because they all look at Pennsylvania as the leading state. So kudos to that. So once, again, that first 9 months, you start to ramp up not just non-medical services, and we add on additional services. So say if, like Oleg, you probably start on the autism side. During that 9 month period, you'll eventually become qualified in the consolidated waiver. I actually don't recommend doing consolidated waiver first because they're very unorganized, and most of the consumers do come through very outdated ISPs and things like that. So like you guys, while we're processing this, we're going to go through the autism waiver at the same time. So you probably get authorized for both payers about the same time, where you'll be authorized for autism services a lot sooner. So you'll just have more referrals coming down the pipe much sooner. Which I do expect because you're a PT and OT. So again, on the non-medical side, it's just community inclusion services, supportive employment, until you're more comfortable to add additional services like 24-hour care, light medical, which includes administering medications to consumers. And so those types of services, that's where the most need is, because most states, they're trying to transition people out of institutions because it's too expensive. So you'll definitely get a lot of referrals on that side as well. So that's pretty much it on the Medicaid side. I went over the 6400 regulations earlier, which pertains to the light medical. On the older adult side, which is you need a clinical team, or you need an interdisciplinary team. And that's why I make sure at least everyone is coming to the table with one of these, fulfilling one of these requirements: PT, OT, RN, speech language pathologist, something that will be able to eliminate at least two of these options to save on costs. And so that's why it's hard for CODAs or PTAs to get started unless they actually have somebody that could fulfill one of these roles.
What is the PACE called?
So the PACE is an alternative to a nursing home. So anybody 55 or older has the option to join a PACE organization where they pretty much would take care of you like a nursing home, but in a local community. Unfortunately, there are only about 200 or 250 PACE organizations in the entire US that are serving about 45,000 people, but over 1 million people are currently qualified. So there's a huge opportunity to create PACE organizations. The only drawback is, which I was reading on the CMS side, it's really hard to predict if they're going to allow more than one PACE organization per zip code. So I do see this expanding. Pretty much all of you could very well have a small PACE organization in your local community, but it allows someone to actually age in place with the supports of your interdisciplinary team instead of a nursing home. So they'll get supports from your team as well as their family, as well as your DSPs to make sure that they can age in place.
So is it pretty much the same thing as the personal care home?
Well, it includes like it has an entire team. I don't think a personal care home has this entire team. It is required to have a dietitian, a doctor. They actually have their doctor's visits as part of your organization. A doctor actually sees them.
Is it an actual site?
Yes.
Okay.
So the requirement is a day program or a day center where they come to that center maybe 2 to 3 times a week, where they can have PT, OT services or see their doctor once a month, something like that.
Is that Innovage?
Innovage is a PACE.
Uh-huh.
PACE.
That's a
Yes.
PACE. Okay.
They're the leading PACE organization in the entire US. They sold part of their organization for about $200 million a couple years ago. So they're quickly trying to expand because, like I said, if they're able to get in all these zip codes, it's going to be hard for other people to break in. So that's why I want each of you to eventually have a PACE organization. You'll have the meat and bones of it by having the home and community service side already in place, as well as having a niche offering. Most of these PACE organizations do not have the skills to support someone with disabilities or autism. Your staff would already be trained in these types of settings. So you'll have an added advantage once up and running. As you can see, there's nothing on here related to behavioral health. As we put together your interdisciplinary team for medical services, there is a requirement to achieve dean status, and that dean status would allow us to start to qualify for this type of organization. So that's the second year once up and running.
Can you go over dean status for people that may not know?
Sure. So dean status is a third-party inspection company like CHAP. So let me show everybody CHAP. So CHAP is it's like an accreditation company that they go to hospitals and make sure that they're in compliance. So because CMS can't go out to all these sites. So they have these organizations that go out and do the inspections so that they can say, okay, this person has dean status, CMS, they're okay. All right. So my partner's CHAP. I like them because they're in Alexandria. I used to live in Alexandria. That's the only reason. But no, they're known. They're known. They're known. Yeah, CHAP is organization that makes sure that your policies and procedures are top notch. Just to go through their program is about $10,000. Right? So that's why we help you start to generate revenue so we can actually pay for that expense. It's not an expense for you. Right? Because my goal is so you could support more people, not go into debt. So if we're able to figure out a way so you could expand and support more people, let's do it. All right, so let's chat. See what types of I'm not going to go into that right now. Let's stick to the pace. Any questions on the pace side?
So what's the timeline for trying to push towards opening up your own pace organization?
It would be at least, we wouldn't start the process until at least a year after you start providing services. Where during that time, we'll start to put together your interdisciplinary team, start to make sure your hub or in your day center is properly located, things like that.
Is this a license?
It's a licensed facility, similar to 6400 regulations. The day center, that is.
So if we were looking on the street, if we were doing like my hub, it would be like, would it have to be a home that was, I'm thinking older adults. So would a home like this be appropriate for them, or would
it's very well possible something like this could be a day program. There's no minimum square footage. I didn't see that.
Yeah, Innovate has, right where I live, they just built like a 4-story brand new construction. I don't know, like 60,
Yeah.
apartments. So they're,
Oh, really?
yeah.
Innovate. Check it out. I can show it to you guys, but yeah, they're the leading PACE organization across the U.S. And again, they can only support so many people. Like I said, they're only supporting 45,000 right now. This is early days.
Yeah.
This is early days. So it's a huge opportunity for you guys as you go through and get started. Over 1 million people are qualified. And as more and more people age in place, this is the best option for them. If you start to like search PACE benefits, it's going to say this is the best option to help people age in place.
Yeah, no, I prefer people to they hear programs and everything right after home health care, because like they do offer therapy and rehab services there too.
Right.
I do that. Provide therapy services in daycare centers.
Oh, cool.
Right. So you're already doing it. There you go. There you go on the joint. Right. Yeah. So you and your interdisciplinary team, you're responsible for putting together this type of plan, like the weekly, daily plan for this patient. Even like you don't want their health to decline, because if it declines in your care, you're responsible for it. So it benefits you to really give intense supports, and with your expertise, you should be able to do that. You have a nurse on hand, you have a doctor on hand, you should be able to handle it. So I actually put together like a schedule or a possible budget to see if something like this could work. So as far as the dietitian, a PACE center supervisor could also be a DSP, like a more experienced DSP. One person could fill 2 roles, right? So you could have you as the CEO also could be, what did I see here? I don't see, there was another role, but the social worker would also be like a quality assurance personnel. There's a requirement for a quality assurance personnel. So I felt like a social worker could maybe come in once a month, maybe have a phone call with them or see them once a month for about 30 minutes, something like that. The nurses as needed. Occupational therapy, again, as needed. You could do once a week or twice a week. Maybe one session, 60-minute session once a week, something like that. It's all based on your availability. So if you say you want to become available 20 hours a week, your PACE organization probably wouldn't have more than 10 or 20 patients, you know, but that's still pretty good. 10, 20 times 3,500, it's pretty good, all right?
3,500 is like what you get for one.
Right, so,
client a month.
so they're trying to move away from fee for service, what comes into where the capitation allows the state and the government to save more money. And so through the PACE organization, I believe it's a lot of money that they're saving. I think it's about $10,000 a year or something like that. Per person. So it really benefits them to have more PACE organizations as well. So like this year alone, they're really trying to get more PACE organizations. They have open enrollment periods every quarter right now.
Are they doing the same thing on the residential side, getting rid of fee for service on the license side for the residential?
On the Medicaid, I think they're trying to figure it out, but I'm still trying to see how they're going to do it. But I don't.
With PDGM, it's kind of already happening because like therapy visits aren't really being compensated that well. So I think it's kind of the entire package. You get paid a set fee amount for an entire 30-day period.
Right.
And then that's why they cut down therapy visits. Before I used to see, so myself and the OT, we would have 16 visits for the client between two of us. Now it's got cut down to once a week, which is 8 visits between the two of us.
Right.
And then so as the nursing visits, they got cut down in half too. So I think that's going away, and it has made us more efficient with our patients.
Right.
On the downside is that it's also limiting for people who actually need it.
Right. Well, in the PACE organization, if you actually own it, you know, you could provide service. Yeah, you call the shots.
Exactly.
You know, so that's the added advantage there. So, yeah, that's the capitation rate. So right now it's about $3,500 the average across the U.S. But I do think it's going to go up more, and you're able to appeal or try to get them to increase the rate as well. And if you have someone with behavioral needs, of course, the rate is definitely going to go up.
Do you have a specific question? You drove all the way out from North Carolina.
It's good to meet you.
And you just started too, so I know this is a deep dive probably right now, but anything you wanted to go over with the group or chat with?
I'm just asking about the business side, like as far as establishing my LLC.
Okay. Yeah. Anything specific?
Well, like I already have an LLC.
Okay.
For just providing OT services.
Okay.
So I was like, do I have to establish a separate one? I do.
Yeah.
That's
Yeah.
pretty much it.
Yeah. You want to keep it separate.
Okay.
Because you're probably providing services in your personal capacity.
Yeah.
So you'll start to have staff that are, when they provide services, they represent your agency that you're billing under. So you'll need a separate LLC. You want to keep it separate as far as liability, as far as managing it with regulations. Yeah, we want to keep it totally separate. But we take care of all that for you, so you don't have to worry about it. I think last year I probably incorporated at least 30 LLCs between real estate and healthcare.
What about for us getting started here in Philly? Like, we're all going to use the house next 2 doors down as our hub.
Mhm.
So, like, is there a requirement, like, you have to be, because we're starting out non-medical, is the requirement you have to be working there, like, in certain hours, or?
Well, it's like a shared space.
Yeah.
So there's no regulations saying you can't work in a shared space. So the plan is to have someone there to, if someone actually does stop in, like say if auditor comes in,
Yeah,
most of the time they contact you. If when they do contact you, they probably will say I'm coming the next day when they actually are there that day. So you wanna just have somebody there and just say you're not available, or you're out in the field. It's okay to be out in the field.
That happened to me.
Yeah, you weren't there.
So I have a virtual office, but I have the virtual full office.
Uh-huh.
So she called on Monday, said, "Hey, I'm just letting you know we're coming sometime this week."
Okay.
So I'm like, "When they gonna come?" I just thought I just asked her. So she was like, "Well, the nurse said we can't just tell you when they be coming, but I'm basically telling you, come." I had something to do one particular day, so I said, "Is there any way you cannot come this particular day because I really have something planned X, Y, Z?" She said, "All right, I'm gonna do you a favor. I'm not gonna come until Friday." That's what she said. She came the next day.
Wow.
So my secretary called me, and I knew I wasn't going to be there because I'm thinking she told me I'm coming on Friday. So she actually came the next day, but they do want to see something like the secretary there to say, like, hey, they want somebody who's knowledgeable, kind of sort of. You know what I'm saying? They don't have to, like, the secretary doesn't know, like, our business per se in and out, but they have to have somebody there,
Right.
especially during your business hours. So I could say, so for instance, my business hours were from 9 to 5.
Mm-hmm.
But next time going in, I think I'm going to change my business hours to maybe like 12 to 3 in the office or on call at a certain time, because they're going to come those times that you put for your office hours.
Exactly.
And they can come anytime during the time.
Yeah.
Right.
Yeah. So you just got to be like creative with your, like, just like you said, you can be in the field. It's not like you have to be sitting in your office 24/7 because how do you want to get the job done? They're not really on like what you do in your daily office. They just want to make sure you're following regulations. You're sending people out to go to these people out.
Right.
So what happened with the follow-up when you weren't there?
I'm at the doctor's, and the other days following, I was there every day waiting for her, but she actually came on Friday.
Cool.
And it was fine.
Yeah. And you don't want to, and that's why early on I made sure everything was online, because I wanted to make sure I'm able to sort through information, answer any questions that they probably have a question on, because the longer you stall, the worse it gets.
The first thing she asked for was the regulations. She wanted to
Yeah.
make sure that we had the regulations there, and then they go through your charts, and then you got to leave them, and you spread everything out, and you just go.
Right. So yeah, my first round, I did that. I hated it. I actually hired people to help me. It was a headache. And then the next time, everything was online. They gave me random dates. They said, all right, September 5th. I want these staff that were working at this day with this consumer. I want to see all their trainings. I want to see the documentation. So I was able to just do a quick search in the application. And so that's when they were like, oh, this is great. I like this. You should share this with other people. And that's when I was confident enough to move on more, because if they're happy, then that means who cares what anybody else says? They're the ones who, yeah, that's all that counts. It doesn't matter what a family member says, an advocate says, you're in compliance. That means you're doing it right.
What are examples of daily activities I am looking to offer to help adults build their social network and increase their social capital. So when working with Stacy to improve her independence, one thing we could work on is dressing, her learning to dress herself more and more independently. So first we would start by analyzing the task of dressing yourself and breaking it down into smaller, littler tasks, such as first picking out what clothes you want to wear, then laying the clothes down on the bed. Then, you could break it down as far as putting one leg into the pants hole while you hold the pants and the other leg, or you can kind of chunk them together depending on the person's ability or where they're at. Once you task analyze, you can teach each piece of the task as an individual step and then chain them together. And many agencies do this, but the hard part is actually fading out the prompting that goes from one step to the next. So what I'm always thinking of and what I work with my DSPs on is to always be considering how do we fade back our prompts and help our client get more independent. So for Stacy, that would involve identifying which prompt works best, using that one, and then just fading that one. So let's say verbal prompting works best. We'd say, okay, Stacy, time to put your pants on, grab your pants, put your leg in. So that may be how we begin to teach it, but then over time, we'd fade that out. It might just go to grab your pants, and then the rest of the task happens. Or a good way to fade prompts is to ask a question. Oh, what do we do next? And then you help the individual kind of prompt themselves. Oh, next I have to do this, then that. So the key is task analyzing the activity and then making sure when you teach it that you're always thinking about fading out the prompts. So Stacy becomes distressed. She gets upset, might yell when she hears loud noises, or when it's difficult for her to complete a task that she has at work. So the way that we would use functional communication training is first assess the function of the distressed behavior. Is she yelling because she wants to be taken out of the situation when there's a loud noise? Or does Stacy yell when she needs help and it's to recruit help with a task? If we can identify that, then we can select a functionally equivalent alternative behavior that works for Stacy. If she has limited communication skills, that may be just saying help. It may be a hand signal, a card. It may be saying break, break if there's a loud noise and she wants to get out of there. It's a functionally equivalent alternative behavior that she can do and that we can help her strengthen so that the alternative behavior competes with the distress behavior and works better. If she's wants to get out of a situation because there's a loud noise and she can say, hey, I need a break, break. She's allowed a break. That's a lot easier than her screaming and yelling and getting all distressed. So that's how we would use functional communication training to help someone like Stacy learn to ask for help and learn to ask for a break when she needs it at work.